We all know somebody that snores at night, and maybe the snoring is so bad that husbands and wives are separated from each other to keep the noise from disturbing the other's peace. But breathing at night is more than a nuisance, and sometimes the quietest of people who may appear to stop breathing are having the greatest danger to their long-term health. First of all, significantly disruptive sleep breathing occurs in about 30% of men and 10% of women, rising in frequency with age and weight, though there are many young and lean-appearing people who struggle with this. Why do I call it disruptive sleep breathing? Because the fundamental problem is not a drop in oxygen levels, though there can be, but the micro-arousals that occur when someone's breathing is restricted numerous times throughout the night. What are micro-arousals? If I were to measure brain activity, you would see many episodes where the brain awakens and is prohibited from reaching deeper, more restful stages of sleep. If I were to measure blood pressure and heart rate during the episodes, they would shoot up, and if I were to measure cortisol, the human stress hormone, it would also rise as a consequence of these breath-restricting events. And why wouldn't it? If someone reached around your throat, choked you, and did the same thing to you as your body is doing to itself with sleep apnea, wouldn't you be freaking out, for lack of a better term? Sleep apnea as a consequence raises blood pressure all day long, promotes daytime fatigue, fat development, poorly controlled abnormal heart rhythms, and in the event your oxygen drops profoundly, sleep apnea causes stress on all the organs of the body. But these are all markers of the body's functioning. I could make the case of the importance of treating sleep apnea by saying to you that you may need less blood pressure medication, you might lose weight and stubborn body fat. I can even tell some of you that it will add years to your life, and these words may have little impact, especially when treatment may require major lifestyle changes. The best motivation I can give you is to say that when sleep apnea is treated, your sleep will be deeper, richer, and the quality of your daytime energy and mental function will be superior as a consequence. Treatment means restoring the normal function of the human body, and thus restoring something that a sleep apnea sufferer has lost, feeling like themselves again, and regaining the deeper satisfaction in life. Instead of worrying about silly-looking masks, the dependence on fiddly little CPAP machines, consider that someone or something is cutting off your breath at night, all night long, taking something away from you that matters more than anything else: quality of life, peace of mind, and unlike most medical conditions, we can treat the root cause of this condition instead of slapping on more medications to manage the effects of sleep apnea. Please consider investigating the nighttime breathing of you or your loved one by scheduling an appointment at sleepdocla.com today.